I'm joined by Dr. Irwin Redlener, Director of Columbia University's National Center for Disaster Preparedness. Thanks for joining us, Dr. Redlener.
Happy to be here, Greg.
Masks have seemed to become the ultimate symbol of the political divide in this country. How did we get here? What factors have contributed to this happening?
Well, it really started with a phenomenal amount of incompetence and incoherence coming from the White House, and particularly and specifically Trump and Pence. And that set up a situation where it was blatantly obvious that the White House was not listening to their own public health experts and scientists who were providing information that was vastly different from what the president was saying. So we set up a situation in the country where people didn't know what to believe, and especially during the time when we're having those daily briefings or press conferences or whatever they were called, where the president would say things like, hey, I'm using hydroxychloroquine, you should too, or maybe bleach will work, or somehow getting UV lights in your body. All of that stuff, which was highly refuted by the experts, created this situation right now, which we have a real partisan political take on what it is that we should do to prevent the spread of the coronavirus and the disease that causes the COVID-19. And this, in a sense, culminated and maximally expressed itself last week at the Tulsa rally that the president held, in spite of severe warnings from his own public health officials and public health officials in Oklahoma. But the visual was a lot of people in the lower levels and on the floor of the Bank of Oklahoma Center were crowded together, not wearing masks, not distancing. The president, of course, not wearing a mask. The place was half empty. It was a bizarre scene, including having these big fans that were blowing whatever aerosols were in the air all over the place. And that, I think, to me, established that we had come to a point where the defiance about following basic public health principles, including masks, in some ways was replacing the MAGA hat. So, if you're sending a message to other people that you're not wearing a mask, the president's not wearing a mask, and we know that you mask wearers are probably liberal Democrats, and it's just been the most bizarre situation. But we've crossed the Rubicon here, and the masks, wearing or not, have become, in many ways and for many people, a political symbol, unfortunately.
So what does the science say? How are masks helping us fight against this virus?
I must say that the science, the literature, the studies that have been done around masks have ranged across the board from maybe not very effective to highly effective. And of course, it depends on what kind of virus we're talking about. And a lot of the tests were done with the coronavirus, but not the so-called SARS-CoV-2, which causes COVID-19. But the other issue is, well, what masks are we actually talking about? They range from simple cloth masks that people make at home to fabric masks that you can buy to surgical masks, and then, of course, the N95 mask. And that's in ascending order of efficacy. If we could do it, and you really wanted to be maximally protected against catching the infection just by being outside and around people, you'd maintain your at least 6 feet distance from everybody else, and you would be wearing an N95 mask. Of course, that's not possible because N95s are in incredibly short supply, and whatever supply there is needs to be distributed to healthcare workers to keep them and their patients safe. And the thing about N95s, I could not wear one unless I shaved my beard off. You could, Greg, but I could not. And because they have to be fitted properly, so there's a very tight seal around them. They're not particularly comfortable to be wearing for hours and hours on end. And theoretically, you want to change even the N95 mask between each patient, you see, if you're in a hospital setting. But we just don't have enough, which is another, of course, tremendous failure of our country to be able to make sure we had a sufficient supply and stockpiling of the masks that we could then distribute as needed. Many months ago, well, actually it was in early March, one of these most senior officials, health officials in government, told me that we would actually need about 3 billion face masks to supply the needs of the country. And of course, we've never even come close to approaching that. So if we can't tell the public to use N95s, what can we tell them that's based on science and evidence? Well, it gets a little bit hazy, but don't forget we have 0 therapeutic tools really that could be in widespread use to actually treat people. And we certainly don't have a vaccine. So what do we have? We have these NPIs, these non-pharmaceutical interventions that are in this array of very strict guidance that's been given by the CDC and many others, which is wear a mask. You can't be wearing an N95, but you can be wearing a surgical mask. If worse comes to worse and all you have is a kerchief or a scarf, wear that. Although the studies are not conclusive in any way, shape, or form that those are good enough. The question comes down to, are they better than nothing? Probably. How much better? Who knows? But I certainly would say from a personal point of view that for myself and my family, nobody is going outside without wearing a mask. And we have surgical masks. This is what I think is the best option or alternative to the N95s. And that's more or less where we are. It's an incomplete science. Much better studies need to be done. There's been studies that have been retracted even after they've been published. There's been studies that have tested viral transmission over just a few inches, which is not useful. We need other kinds of studies. Most of the studies that are out there have been extremely small samples. So I think we're taking the judgment of experts on this, and they're saying wear a mask, and I think we need to comply with that.
Okay, you mentioned that studies vary and they're not conclusive, and then you said, but wearing a mask is better than nothing. Is it much better than nothing? Maybe not. Is that a strong enough message, you think, to the non-mask wearers and the non-mask believers out there to suddenly start adhering to wearing a mask?
Well, it depends on how much you want to go. If basically we're saying, here's all the studies, and my conclusion, and the conclusion of the vast majority of my colleagues in public health and in epidemiology, if our conclusion is, yes, you should wear a mask, and it definitely is better than nothing. Is there 100% conclusive scientific evidence that every kind of mask, whatever kind it is going to be effective? We just don't know that. The studies have been, kind of lousy, actually. Ill-conceived, not large enough samples, assumptions made that, that were not necessarily appropriate. That said, we are concluding, we meaning the public health community, please wear a mask or don't go out. If you want to go out, you've got to wear a mask, and you've got to stay separated by at least 6 feet. There was a case just a week ago in Jacksonville, Florida, of a bunch of people getting together in a bar without masks, without distancing from one another, and 16 or 18 people got infected with COVID. That's really what the answer is. If you want to not get COVID and not become a spreader of this very dangerous disease, you should do the best that we can based on the best knowledge that we have. That equals distancing, and it equals wearing a mask, period. That's what we got. So yes, wear the mask, stay away from people. And I think that's really what we have to offer right now, and people should adhere to that.